Hi, my name is Erin, and I'm a certified genetic counselor with SDX Labs. In this video, we will discuss the meaning of a high-risk result from non-invasive prenatal screening, or NIPS. We will discuss how NIPS works, what a high-risk result means, how to understand your new risk, possible explanations for a high-risk result, and next steps. Before we get started, you may be viewing this video because you recently received a high-risk NIPS result and are looking for more information. If so, it's understandable to be feeling concerned or overwhelmed. It's important to remember that NIPS is a screen, meaning it cannot give definitive answers, and more tests are still needed to determine if the baby definitely has or does not have the condition of concern. Non-invasive prenatal screening, or NIPS, is a blood test that can be done during pregnancy to screen for certain chromosomal conditions. In pregnancy, fragments of placental DNA can be identified in the pregnant patient's bloodstream. These DNA fragments are evaluated to see if the expected amount of material from each chromosome is present, or if an atypical amount is detected that could suggest a chromosomal condition in the pregnancy. For example, the condition Down syndrome, or trisomy 21, occurs when there are 3 copies of chromosome 21 instead of the typical 2 copies. NIPS would come back as low risk for Down syndrome if the expected amount of material from chromosome 21 is identified. If an overrepresentation of material from chromosome 21 is identified, this could be suggestive of an extra copy of the chromosome in the pregnancy, and the NIPS result would be high risk for trisomy 21. Your NIPS result gives a low risk or high risk result for each condition screened. Your report will clearly show for which condition, if any, your pregnancy screened high risk for. A high-risk result means that an atypical amount of chromosomal material was detected in your bloodstream, and the pregnancy is at increased risk for that condition. After receiving a high-risk NIPS result, many patients are anxious to have a better understanding of the chance that their baby has the condition of concern. When evaluating your high-risk NIPS result, your doctor or genetic counselor will consider many factors that could impact your new risk. If you are pregnant with just one baby and your NIPS result is high risk for trisomy 21, trisomy 18, or trisomy 13, your report will show a PPV, or positive predictive value. This is a number that the laboratory calculates to estimate the chance that the baby is actually affected by the condition. For example, if the PPV on your report is 80%, that means that there is an 80% chance the baby has the condition and a 20% chance the baby does not have the condition. PPV can be a great tool to help put your NIPS result into perspective. But there are some important factors that impact your risk that are not considered in the PPV calculation, such as ultrasound findings. Regardless of the PPV, all high-risk NIPS results should be taken seriously and receive follow-up care to determine if they are true or false positives. There are a few possible explanations for why a high-risk NIPS result may occur. 1. The baby has the condition or another condition affecting that chromosome. This is known as a true positive. 2. The placenta has the condition but not the baby. This is known as confined placental mosaicism. 3. The test identified a chromosome condition that is present in the pregnant patient or in a twin that miscarried early in the pregnancy. 4. The result is simply a false positive and the baby does not have the condition. Now let's explore your next steps. The best next thing to do is to speak with your doctor or genetic counselor about your NAPS results to better understand your new risk that the baby could have this condition, and to discuss diagnostic tests that can be done to give a definitive answer. Prenatal diagnostic testing, such as chorionic villus sampling or amniocentesis, can be done in pregnancy to give a yes or no answer. Having a prenatal diagnosis could inform pregnancy management decisions or prepare for post-birth care. No irreversible decisions about the pregnancy should be made based on an NIPS result alone. If prenatal diagnostic testing is not right for you, diagnostic testing can also be performed after the baby is born. It can be stressful to receive a high-risk NIPS result. Chromosomal conditions can occur in any pregnancy, and there's nothing a person can do to cause or prevent them from occurring. As you learn more and determine your next steps, just remember that there are no right or wrong answers, and it's important to do what is right for you and your family. If you would like to speak with a genetic counselor about your NAPS result or next steps, you are welcome to reach out to us here at SDX Labs or visit www.findageneticcounselor.com to find a genetic counselor in your area. At SDX Labs, we believe in providing patients with the most proactive screening tools available to help them make informed health decisions. For more information on genetic conditions or the services offered by SDX Labs, please see the rest of our video library or reach out to us directly.